What is hMPV virus, human metapneumovirus symptoms, prevention and how to stay safe? Human metapneumovirus, hMPV, is a pathogen that has recently garnered attention in the global health arena. This comprehensive guide aims to provide information on hMPV, its impact, and preventative measures for individuals and communities. Who is at higher risk for hMPV infection? Like other respiratory illnesses, hMPV poses a higher risk to certain groups. Young children, older adults, individuals with weakened immune systems. hMPV transmission, how it spreads. Human metapneumovirus, hMPV, is primarily transmitted through close contact with infected persons via respiratory droplets or aerosols expelled during coughing or sneezing. The virus can also be transmitted through contact with contaminated surfaces, as it can remain viable for short periods. Therefore, hand hygiene is essential in preventing the spread of hMPV. The incubation period for hMPV is estimated to be between 3 and 6 days. During this time, an infected individual may be contagious without exhibiting symptoms. This characteristic makes containment challenging and emphasizes the importance of preventive measures. hMPV infections have a disproportionate impact on children under the age of 14, which can sometimes strain healthcare resources. hMPV causes. Although the precise causes of hMPV infections are not completely understood, several factors may play a role in its transmission. Seasonal patterns. hMPV infections are more common during winter and early spring. Environmental factors. Crowded indoor spaces with poor ventilation can facilitate the spread of respiratory viruses like hMPV. Co-circulation with other pathogens. The simultaneous circulation of hMPV with other respiratory viruses, such as influenza and COVID-19, may complicate diagnosis and treatment. Genetic changes. Like all viruses, hMPV can mutate over time, potentially leading to more transmissible or virulent strains. hMPV symptoms. hMPV infections can manifest a range of symptoms, often mimicking those of other respiratory illnesses like the common cold, flu, or even COVID-19. This similarity can make initial diagnosis challenging without specific testing. The most common symptoms include cough, fever, nasal congestion, sore throat, shortness of breath. In most cases, these symptoms are mild and resolve on their own within a week or two. However, in severe cases, particularly among vulnerable populations, hMPV can lead to more serious complications. Bronchiolitis, inflammation of the small airways in the lungs, common in infants and young children. Bronchitis, inflammation of the larger airways, causing persistent cough and mucus production. Pneumonia, infection of the lung tissue, which can be life-threatening in severe cases. Asthma or cough flare-ups, exacerbation of existing respiratory conditions. Ear infections, secondary bacterial infections of the middle ear, particularly in children. It's important to note that the severity and duration of symptoms may vary greatly depending on the individual's age, overall health, and immune status. While most people recover without complications, the elderly, infants, and those with pre-existing lung conditions or weakened immune systems face the highest risk of severe outcomes. hMPV seasonality. hMPV is more prevalent during winter and early spring, similar to many other respiratory viruses. hMPV treatment options. Currently, there is no specific antiviral treatment or vaccine available for hMPV infections. Management of the disease primarily focuses on alleviating symptoms and providing supportive care. The approach to treatment may include rest and hydration, encouraging patients to get plenty of rest and stay well hydrated to support the body's natural healing processes. Over-the-counter medications, using fever reducers and pain relievers like acetaminophen or ibuprofen to manage fever and discomfort. Nasal decongestants and saline sprays, employing these to relieve nasal congestion and improve breathing. Humidifiers, using these devices to add moisture to the air, which can help soothe irritated airways and ease coughing. Oxygen therapy, in severe cases, providing supplemental oxygen to patients with breathing difficulties. bronchodilators, administering these medications to open up airways in patients with wheezing or shortness of breath. Antibiotics, prescribing these only if a secondary bacterial infection develops, as antibiotics are not effective against viruses. It's crucial to note that antiviral drugs are not routinely recommended for hMPV infections. Health experts caution against the indiscriminate use of antivirals, citing risks of drug resistance and potential side effects. Instead, the focus is on early detection and appropriate supportive care. For most individuals, hMPV infections resolve on their own with time and rest. However, those at high risk for complications should be closely monitored and may require more intensive medical support.